Well, 2019 was a year when the entire nation were reminded of the parlous state of aged care. For months, we watched witnesses at the Royal Commission tell of the lack of care and staffing, the hopeless service of food, and in far too many cases, even the shocking abuse of the elderly residents themselves. But in a new submission to the Commission, the Nursing Professional Association of Queensland has come up with an ingenious neighbourhood nursing scheme which could be a solution to the current crisis. It is all about reducing demand for aged care facilities and keeping older Australians in their homes longer. To tell us about the scheme, I've got the Association's Assistant Secretary, Jack McGuire, in our Brisbane studio. Thank you very much for your time, Jack.
G'day, mate. Thanks for having me.
I like the idea that those in the front line of aged care, the nurses, are having a chance to have their say. This is one of the beauties of this scheme, isn't it?
Yeah, that's right. So in compiling our report to the Aged Care Royal Commission, we obviously took hundreds and hundreds of submissions from those nurses working in the aged care sector, as well as reporting on some of the horror incidents, people not being bathed for sometimes over 2 years, nurses' registrations being put at risk, all sorts of really horrendous things. We've also done some really rigorous research, and we think we've found an interesting solution in the Netherlands. They call it Buurtzorg, which stands basically for neighbourhood care. We put that solution to our members, and they seem to love the idea. The scheme itself is in the Netherlands works. They employ 15,000 nurses with an administration team of 40. And the way that they do that is by placing more trust in those nurses. They have self-governing teams of 12 nurses that then go and set their own rosters and deliver care themselves. And it's seriously revolutionised aged care in the Netherlands. It's almost
and so the nurses
away the need for aged care facilities.
Okay, so the nurses are being paid by whom?
Well, that would still be a mixture of either public or private. If it was to set up here, we would need some structural changes to the way that aged care funding is given out. We dare say some PHNs at some public hospitals would think that it's a great idea because it would stop a bigger drain on public hospitals and people presenting to public hospitals. I guess the way forward would be to, instead of publicly fund beds in aged care facilities, we should be opening up more at-home packages and looking at a system where it's far less administratively burdensome, and we get to pay nurses more and employ more nurses.
Yeah, this is interesting because I would have thought the cost differential between what the current system is and what you're proposing would be massive, wouldn't it?
Well, I guess people seem to have forgot in this conversation the value of a nurse. We send these people to university for 4 years. We've ended up with a system now where most care is given by people who go to do a TAFE course for 3 months. What we've seen, even under the NDIS, is that people, one provider we spoke to have had 12 work cover claims because they don't know how to lift properly. You see more medication errors, so there are more presentations to hospital. A carer can't perform an assessment if there's been a fall, so a registered nurse can assess whether there needs to be an ambulance called and whether that is a necessary presentation to hospital.
And it's not always really the case that a registered nurse is at an aged care facility.
Well, sometimes there's one registered nurse and up to 30 or 40 carers, they're way too.
So getting back to this cost differential, we're talking about a difference in billions, aren't we?
Well, I mean, if we have a look at what happened in the Netherlands, Buurtzorg as the organisation, the charity that they set up over there, ended up saving the government millions of dollars.
The Commission found that 16,000 people died just waiting for a bed. So part of the problem, which has created the crisis, is the fact that the demand to get a bed or get a room is just far too much for the sector to carry.
That's right, and there's too much money being funneled into these aged care facilities, and the people that are making all the money are the ones that are running these aged care facilities. If you freed up some of that cash and you gave it to families to be able to keep their loved ones in home longer and provide that care, you'd end up with a far better situation. We have the interim report that was handed down by the Commission said one of the big findings was that people really don't want to go. It's a big life step for people to go into an aged care facility, and they don't want to do it. So why not listen to them and keep them at home?
Yeah, it makes sense to me. I get the feeling too that the Prime Minister could be on your page with this, because soon after the Commission wound up some of these hearings, he threw $500 million at in-home care. So he sees that more needs to be done to keep people at home and cared for. So he might be on the same page as you guys.
Well, he'd be a sensible man if he did listen to our submission to the Aged Care Royal Commission. We've got a whole hundreds, as I say, nurses who provided their feedback, so it is valuable feedback. If we do have a situation where this launches in Australia, we suspect there would be about 30 or 40,000 extra nurses need to be employed around the country, so that places upward pressure on nurse wages, which is a fantastic thing.
Yep.
And you end up with a far better service for the elderly.
Yep, and a lot of nurses who've since left that role could come back and be handy in these community neighbourhood groups, couldn't they?
Oh, absolutely, absolutely. Yeah. And we may see that some of these unskilled carers may in fact go to university and get those skills that they need to become nurses.
And the trick would be lots of communication between your local hospital, your local GPs, your social workers and nurses. That would be the trick to identifying who needs help and to bring them into the network.
Yeah, that's exactly right. I mean, you'd really need a hybrid model of what's happening in the Netherlands and trying to apply that into an Australian scenario. In fact, our founder, Graham Haycroft, is over in London at the moment talking to the Buurtzorg people about how that may work and look in Australia, and we're keen to provide those results when we have them.
There's probably a minister or two who need to do the same thing, I would have thought.
Well, our phone's always open.
Yeah. Exactly. Finally, I just noticed that in the story that was in the Courier Mail over the weekend on this subject, I think Mr. Haycroft was saying that in the Netherlands there was a price differential saved of up to $4.5 billion. That's an extraordinary saving in that sector. Absolutely, and there are savings that not only could be made in the aged care sector, but also the NDIS. Most people may not realise that nurses have actually been carved out of the NDIS funding model. There is huge amounts of money for disability support workers, again, those that have had a quick TAFE course as opposed to a 4-year tertiary trained nurse. There could be huge value provided with at-home care with registered nurses. Yeah, I think this has got legs and I hope you keep pushing it. Jack McGuire from the Association, thank you so much for your time.